Hello, how are you doing? How are you doing? Today, I wish to share with you something of great importance, something that has raised some concern among us the diagnostic fraternity, especially radiology. Uh, I've decided to post this video not to uh, not really designed for those that are trained in ultrasound, but is for patient satisfaction. Patient satisfaction is very important at every health center, be it private or uh, public, which is government. Now, I'm going to pick uh, one area where we need to shed more light, and that is ultrasound scanning. I'll pick one general condition. A patient comes to the department with abdominal pains. They have pain in the abdomen, and their clinician says that such a patient needs to do some scanning so that we may find out or investigate the problem. You need to understand that ultrasound, despite its great importance, has its limits. Ultrasound has its limits. There are small conditions that are very painful and can be picked on ultrasound. Remember, ultrasound is a machine, and the one who sees is a person, it's not a microscope. This is why you can have ulcers in your stomach, you can have urinary tract infection or UTI. If it's in its early stages, it can be picked. So ulcers, you can't see ulcers on the scan, but you come to the department or the clinic crying. You can't even sit upright because you have sores in your stomach, you have sores in your intestines, or just somewhere within your alimentary canal. Ultrasound is not going to establish that. Instead, you need to do other diagnostic tools such as endoscopy for ulcers. Again, for early UTI, urinary tract infection, for example, there's infection in the bladder, you feel pain in the lower abdomen, ultrasound is not going to pick that. Instead, you need to do urinalysis or equivalent. For kidneys, maybe there's early infection in the kidneys, for example, a condition called pyelonephritis. It can't be picked up on ultrasound in its early stages. Instead, it can be picked up by laboratory tests. So you may be feeling pain in the sides of your abdomen. It may be a sign of nephritis or renal or kidney infection. But if your doctor says, your doctor of scan says there is no problem, does not really mean they didn't see the problem or maybe it's not there. No. Some conditions can never be picked on ultrasound. And this information is also important to our clinicians. They need to know that a normal ultrasound does not really exclude what they are suggesting. So it is the duty of every clinician to go further and do extra tests. And again, it is a duty of you, the UCF radiographer or the UCF sonographer, to provide alternative tests according to what you think. You have an impression. For example, you may have an impression of acute appendicitis, and you may not see it there, or maybe subacute appendicitis, which may not be picked up on a basic ultrasound machine. It is your duty to advise or to liaise with the referring clinician for the betterment of the patient. In the nutshell, we are not going to talk about what can be picked on ultrasound because there are so many. We are going to say ultrasound cannot see certain conditions. So if you are a patient, then you come for scan, then we tell you that there is no problem. You need to understand that some conditions cannot be seen on scan. So when you go back to your referring physician, they are not going to let you go home and say you're okay. They are going to prescribe something because those people learn it, they know. They used to treat us even before scan. So that's why they still give you something, even if the scan report says there is no problem.